Good day, global citizens. Welcome to another episode of Dr. Fajembola'S opinion. On today's episode, I bring you a good old colleague. I always come with the adjectives. A good old colleague to discuss dysmenorrhea in Nigeria. So join me to welcome Dr. Benedicta Apuamah. Right? Pharmacist, you are the first pharmacist I'm inviting. Pharmacist Benedicta Apuamah. I hope I pronounced your name right.
Yes, you did.
Okay. Thanks so much for joining us on this episode. First of all, let me give you the biography of our guest researcher for this week. Pharmacist Benedicta Apuamah is a Nigerian-trained pharmacist, global health expert, and passionate advocate for the United Nations Sustainable Development Goals. With over 5 years of program management experience, she has contributed to projects funded by the Global Fund and the CDC, collaborating with organizations such as Management Sciences for Health, the United Nations, and SOS Children Villages International. In 2017 and 2018, Benedicta served as a One champion, representing Nigeria and Africa at the One Youth Summit in Brussels, where a presentation earned a standing ovation from the then One.org CEO Gayle Smith. She further honed her leadership skills as the chairperson of the Reproductive Health Caucus at the Tanzania International Model UN in 2019 and was recognized as a delegate at the Global Engagement Summit in Chicago in 2020. She earned a master's degree in international health and social management with distinction in 2023 from the Management Center Innsbruck MCI, supported by the Ban Ki-moon and One World Scholarships for her SDG advocacy. That same year, she interned with the UNODC HRMS team in Vienna, contributing to innovation projects. In 2024, pharmacist Benedicta won the Science P-Talks contest at the Geneva Health Forum for her outstanding public speaking skills. She's the founder of Girls for Development Goals Foundation, driving community health initiatives in Nigeria, and currently works at MCI as a project assistant with the EUSIOS European University Alliance team. Pharmacist Benedicta resides in Austria with her family and remains committed to creating lasting global impact. Very beautiful biography, and congratulations on your masters. The last time we were in touch, you had looking forward to any your PhD if you are interested in it. Are you interested in academia?
I will be very careful the way I answer this question because I have a professor father.
Oh, what does it have to be an emeritus professor?
Well, I would love to have a PhD, but as for being in academia, I'm not completely sure. I am one of those who would like to thread the path between bridging research, policy, and grassroots or community health projects. So we're one of those who believe it's not just, speaking all the big grammars in research. How does this translate into what affects, the everyday child or the random young girl, in some community or a city? So, yeah.
Okay, thank you so much for elaborating on that. What I do now on recent episodes is because we are trying to make these scientific publications very understandable and very relatable to the layman. Anyone outside STEM can watch them and understand what we're trying to say. So what I do now on recent episodes is get tweets from X on what people are saying. And since we're talking about dysmenorrhea today, I got tweets on around menstruation. Let's see what global citizens are saying about menstruation. The first tweet is from Kara Dansky, where she said, once when I was a young teen, a friend got her first period in very public and crowded place while wearing white clothes on a hot summer day. She cried in the women's room where my friend had to strip from the waist down to so that her mother could clean her clothes in the sink. Her mother then gave her something to wrap herself in. While my friend cried, her mother said, "Don't worry, honey. We are all women in here. We all understand what you are going through." Every single woman on the face of the planet, even if she has not had a similar experience, will immediately understand how traumatizing that must have been for my friend and why I remember it so vividly. No man on the face of the planet, even though many of you will feel sympathy for my friend and support your cause. I stand with Sandy Page. It seems there was a hashtag that was trending around menstruation on X. The second one is from Mordaza. It's about a Taoist inner alchemy source stuff to indigenous lunar traditions. Teaches that menstruation holds the potential for sacred growth. Embrace cramps as a guide for inner awakening, compassion, and personal transformation. Some people associate inner energies to menstruation, even the days, different days on menstrual days. Actually, I don't do that, but some people find
I
that
don't too.
interesting. Some people find that interesting. People who believe in science and all these Sagittarius, Cancer, yeah, I believe
Horoscope.
they will relate with that. The
Yeah.
last one is from Stand with a Girl Initiative. She said, the person tweeted, whether he or she said, weeks ago, a 23-year-old young man made a bold move. He stood up in a large religious gathering and corrected myths and misconceptions about menstruation. What inspired him? He has been part of our Dignity in Menstruation project, where he is learning to challenge harmful norms. You see the benefits of including men in
Yeah.
whatever things we are doing as women. It shouldn't be only women engagement, because when you put men in this stuff, they understand and they are able to make better decisions as sons, as fathers, as brothers, and as uncles in our communities. So on today, we are discussing the paper Dysmenorrhea in Delta State. And I'm so happy to have you. It's an honor. In case you don't know, it's an honor to have you as the first female guest researcher on Dr. Fajembola'S opinion. Thank you so much for honoring the invite. And that is why I'm more specific about it being, since you are the first woman, more specific about it being about also women's health. Doctor, sorry, I said doctor. I'm used to call him doctor.
I will
Pharmacist
become the doctor.
Apuamah. Okay, with the titles, Pharmacist Apuamah, you have a non-governmental organization. To the best of my knowledge, it's about women's health. Can you tell us a bit about your NGO?
Yes, it's called Girls for Development Goals Foundation, and yeah, I started it a couple of months after I finished from the School of Pharmacy, Delta State University, America. So, backstory as to why I started it, and everything. I attended an all-girls boarding school in Warri, also in Delta State, and all girls means there were so many people around me that were menstruating. And just before I got into the secondary school, the high school, I was very curious about periods. So myself and my friends in primary six then would go behind the class, would sit down because of course we don't want the boys to hear what we're saying. And then we'll start asking ourselves, has your period started? Has your own started? This, and then eventually one of us started first. Gina, oh, I hope to find to communicate with her since it's been such a long time. And she was telling us how it was for her. So I was just looking forward. And typical of mothers, before I went into the boarding school, my mom told me about periods, bought pads for me, even though I hadn't started, in case it starts in school.
That's
So
beautiful.
yeah, so it was having that experience. Eventually, when my period started, it was painful. Oh my god, it was painful, and it was also one of the motivation for doing the research in my undergrad as my project. And yeah, so I thought, why not engage with women and girls to talk about topics like this, especially, and also teenage pregnancy, sex education, some of those topics that we're not
Yeah.
very comfortable with, speaking with our parents about.
Yeah.
And yeah, that we prefer to speak with our friends about. Why not have proper information, a safe space where the young girls can ask questions, and get the right answers. So that's literally how it started. And then we've gone on to do lots of projects on teenage pregnancy, menstrual hygiene, and even partnering with local and international organizations on this. So, yeah.
Thank you so much, Pharmacist Apuamah, for stating that. Actually, I'm just knowing the research is an undergraduate, your undergraduate project, what you work on at
Yes.
undergraduate level. So
Yes.
that's good to know. Menstruation, I don't know, there's lots of stigma globally about which is reducing with more exposure and more advocacy about women's health. And um, a facet of menstruation which people don't like to talk about, even though it's a problem. And even when people feel this pain, because of the stigma around it, they find it hard to talk about dysmenorrhea. And for those watching us who don't know what dysmenorrhea, they just have menstrual pain. Menstrual pain is dysmenorrhea. Anything that has this is a medical term. This is DYS. This is pain. Menorrhea is menstruation. So I won't say I'm very lucky, but let's say I'm very lucky. I'm not very lucky. Maybe that's why I'm very, 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 I have low pain threshold.
Right.
Maybe that's why I have low pain threshold. I have maybe very mild menstrual pain, maybe less than 5 times in my entire.
Oh,
So when people are
wow.
talking about menstrual pain, I can't really relate to
Oh,
menstrual.
my God.
Yes. I can't really relate to menstrual pain. So I would say that's also one of the things that affected my pain threshold. Maybe God knows I can't take pain. I'll put it that way. Yes, but I really felt pain. When I would say pain, one of the things Dr. Prish, those who follow me on social media know Dr. Prish. Dr. Prish is a synonym for doctor for pain, redness, irritability, swelling, heat. Those are the signs of inflammation. So no matter how good you are as a medic, no matter how good you are as a pharmacist, if you're not taking the patient's pain away, you are almost not doing anything. So pain management is very important in everything we do. The one time I felt so much pain was after my first cesarean section and my second cesarean section, and every other thing felt when I'm feeling pain, every other thing is secondary. I just want that pain to get out
Mm.
of me. So, Dr. Apuamah, I would like to know the majority of the respondents in the study were single, while majority were average, while majority of the average were married respondents have been married for 1 to 15 years. Over 70% of all respondents had never been pregnant. These characteristics are also expected to impact on the prevalence and patterns of dysmenorrhea in this population. Do you feel dysmenorrhea is downplayed in Nigeria?
Yes, I think it is. Although, good to emphasize that this research was done 9 to 10 years ago, but I try to do a quick catch up, on what is also going on now, and I can see that the prevalence is also still high. And I believe that this is greatly linked to the fact that culturally it is believed that women should be able to bear pain. Men, pain is part of life. You have periods. Yes, it's painful. Suck it in. And then I will also share personal experiences because even as a young teenager that was menstruating, the pain was so much, and every time I spoke about taking pain reliefs, initially I was made to believe that no, don't. If you take a pain relief, you will get used to it. You will get used to it, and then when the pain, I don't know, when the pain medicine isn't there, you will not be able to cope. I think as a young girl, I accepted that for a while. It was so painful. I'll curl in bed. And even in the boarding school, on the first and second days, I probably would not be able to go to will not be able to go to class because you would know something is wrong. I will be restless. I'll be, you know. But as I grew, and especially being a pharmacy student, I began to challenge those things to say, who said that if you're in pain, you should take medication to take care of the pain? So I believe that dysmenorrhea is largely downplayed in Nigeria, mostly because of culture and beyond people having to come to pharmacies or to doctors to ask for pain medications and all of that. We have found alternative ways, so alternative medicines. I remember as a border, my then house mistress got hostel matron, God bless her soul. She used to make bitter leaf. She would
Drink.
wash bitter leaf. Oh my God! Pour it into the
Scrub.
cup and come out with a long whip. The moment she sees me, when I was in the junior secondary school, because I was in the boarding school for the entire period of my high school,
Wow.
ladies high school, worry, and the first 3 years, the junior school is school one, the second part is the school two. The school one, I was known whenever I have stress, not feeling well, they know it's malaria. But in the senior secondary, it was period pain. They knew I couldn't take it. So she would always wash that and give me. The way she sees me, Benedicta, what is it? It's either period pain or it's malaria. One of the two. You can't miss it. Most likely, it was period pain. And she would give me that. She would give me hot, rub. So we have grown to get alternative, measures, which is great. And so it also reduces the possibility if you want to track its prevalence with mere hospital appointments or pharmacy prescriptions and fill outs. So yes, definitely it is downplayed.
What factors are contributing currently to dysmenorrhea in Nigeria?
I That question is, it's quite difficult. I will still bother on the topic of, culture because of how we are raised, and all of that. But I don't know if I should believe that maybe the foods that we eat too. For instance, a slight deviation in our parents' times, it was rare to find women who went through cesarean sessions. You just mentioned that you've had two already.
Yeah.
I have also had two. So what exactly is going on? What is causing this? Maybe now back to the topic of painful menstruation. Could it be that in our parents' time, because of how they raised culturally, that they couldn't talk much about it? There was no social media, so all they could do was to bear it and make do with the options they had, or and so it could be that they couldn't help it. They have developed high pain thresholds, you know, or could it be that the food and the diets and everything that's also adding to it? Because if you also look at research and statistics, we are having more girls have their menarche or menarche at younger ages than how it was in our parents' time. So girls are menstruating faster. People have period pains. There's a lot of fibroids happening now, endometriosis. So I really think that it's something we should pay attention to, whether as researchers or government, especially leaders in the health sector. how, we can demystify the topic, debunk lots of myths around it, and just make it easily accessible for for young women who need help to get help. Because in the course of, in fact, what really made me interested in this topic was in the high school, because of the level of pain I was feeling, and how they would tell you, stay away from sugary foods because the months you eat more sugars, processed sugars, the more pain you have. I walked to my teacher, Mrs. Oshoma, and said, Ma, what is the link between what is the link between and period pain? And this was many years ago. My teacher was honest and humble enough to tell me that she didn't know that it's something medical. Maybe I should read on it. And that's actually what sparked my curiosity on the topic. I began reading and researching, wanted to know, why do I feel this much pain, and all of that.
Thank you so much, Pharmacist Apuamah. Actually, I feel a large part of why it's downplayed in Nigeria is because of the culture of we are women. We should be, it's part of us. We should hold the pain, and the stigma around, apart from the culture of women should be strong and take the pain in, the stigma around menstruation. So around menstruation for women. So that's why really there is I won't say ignorance, why it's largely ignored by some people, a large part of global citizens. First, Apuamah, thank you for that excellent elaboration. I would also like you to tell global citizens, as a pharmacist, have you worked in a pharmacy? Have you ever worked in a pharmacy? If yes, how often do people buy pain medication? Because when people have dysmenorrhea, some people that don't want to take their pain in or are saying that this pain is too much for me, they go to get pain medications. Where we come from in Nigeria, not the global north. They can go to a pharmacy and get pain medications for dysmenorrhea or ask for a medication for dysmenorrhea. How often have you experienced that?
Okay, I would also like to state that I haven't practiced in a long time. Yes, I've worked in the pharmacy, and so I'm going to share based on the experience I had while I worked. Yes, and I think yes, we young girls come often to buy pain medication, and I believe that some maybe local or international pharmaceutical companies saw the opportunity in this and now created a medication. I don't remember the name right now, but there was a medication that they clearly put the name for you to know that it was menstrual pain. It was for menstrual pain, but I think it was just like diclofenac and maybe another combination to just help the woman relax, and for the pain to go away, at least in the time being. So yeah, it was that alone tells you that this company identified that this was a growing need for a pharmaceutical company to invest in doing such. That was a growing need in that area.
So in a day, like how often do you receive complaints of dysmenorrhea as a pharmacist when you practiced?
I don't think that there were like lots of complaints. They knew they needed pain medications. So once they come, they're asking, for pain medication because of this. So it was just, oh, I'm having extra pain. What can I get? Or do you already? Some of them already know. Do you have either diclofenac or ibuprofen? Yeah.
Okay, thank you so much. Actually, aside the stigma around menstruation and the cultural cover-up of taking in the pain, most people, actually Nigerians, have antibiotics at home like it's a norm. They will have a polypharmacy at home, antibiotics, paracetamol, sometimes ibuprofen, and also diclofenac. So when they want to use, instead of going to the pharmacy, like they buy the paracetamol anytime something happens, whether you have an headache or anything, it works for anything. You use that you get from the polypharmacy at home. So it's beautiful to know that some companies actually invest. It's due to the more awareness on platforms like and on research that people like you have done to help improve the quality of life for women. So I would like to know, this research was done in Delta, do you feel there is significant underreporting and documentation of dysmenorrhea among Nigerian women?
Yes, of course. Like you mentioned, beyond beyond having alternative measures, because if a person has dysmenorrhea, and like my matron was doing for me, I was not reporting at the hospital to get anything, or the pharmacy. She would just get bitter leaf for me, wash it and give me to drink, give me hot things to put around my stomach. So because of that, it's definitely the problem of underreporting. And then back to the health seeking behavior of the Nigerian people. You just mentioned almost every family has a mini pharmacy in their house. Antibiotics, paracetamol, and all of these things. So whenever they have pain, they may not necessarily report to the pharmacy. They can just take from what they over the counter medications and even prescription medicines that they already have stored at home.
Thank you so much. Actually, I also agree that it's significant underreporting because even those in urban settings, it's really go to the um, hospital or clinical settings to report of dysmenorrhea, let alone those in rural settings. And if they don't go, is what you have, is the statistics you have, that's what you document. If it's not documented, then you feel as if even though people are talking about it in the community, even though homes are feeling it, you don't really feel like there is it's really has an effect on the health of women in Delta State, not just Delta State, but in Nigeria.
I think most times when they report is when maybe they see it's really serious. Um, my younger sister also have or this area, and the youngest I think has it as severe as I do. So
Well,
do not have the experience. Imagine a child is menstruating and is stooling and vomiting. Such panics can actually make the woman take the child to the hospital. I had a classmate once who, while I was still in the boarding school, she shared her experience with us. I think it even happened from school. Pain that she passed out. She had to be rushed to the hospital, and the mom was already panicking, thinking maybe she had gotten pregnant or something. But she wasn't. It was just this area. The pain was too much. So and it's sad that it's only in such extreme cases that they show up. Sometimes it could be normal, because in the course of doing this advocacy, especially around the time I did my bachelor research, bachelor thesis, it could be normal that this pain is like that. But other times it could be a pointer to a more serious problem, like endometriosis.
exactly.
And I actually encountered someone 18 at that time who was diagnosed with a similar problem. So when I was doing the advocacy, and talking about it, she was able to, come to me afterwards to say, what you're talking about is actually, what I experienced. And so there is gross underreporting, definitely.
Thank you so much for elaborating on that, Pharmacist Apuamah. I would like to know the childbearing age from this paper because I read the paper. Maybe I didn't get it. I read the paper and I didn't get the childbearing age, and it was emphasized. What is the statistics you got from Delta State on childbearing age range?
So globally, it's between 15 to 49. But in my research, childbearing age is technically reproductive age. So it was mostly from around 15 to 25, which aligns with the global figures. Yeah. So that's it. May I also add that the link between the link between reporting dysmenorrhea and uh, parturition, which is childbirth. I had a conversation with my professor after this research to say, oh, this is what I found out, that some people who said they had period pains, severe ones before childbirth, said that after childbirth, it reduced. So I was saying, oh, could it be that the process, of having babies actually helped them? But my supervisor pointed my attention another angle to another route, just like you mentioned, pain threshold. Could it be that their pain threshold had increased because of labor pains, delivery, or cesarean sections, like you said? That could be it too. Because in the course of my research, and as at that time I was just a young girl, and now as a woman who had not mild dysmenorrhea versus me now after two children, I can tell you that it's not the same. It's more tolerable right now. So which actually points to the fact, to some in this in the research, in the study, that it could be that the pain threshold had gone up. I don't know what happens that makes the pain reduce, but it is actually true.
Okay, thank you so much for shedding more light on that, Mrs. Apuamah. We have period poverty. To me, I feel that two problems Nigerian women face, not just Delta women face with regards to menstruation. Period poverty, dysmenorrhea. Which one do you feel Nigerian women are more concerned about?
I think they're more concerned about period poverty because because it's one thing to have the resources or the tools you need to actually take care of the period, before even complain about pain. It's like a double burden. Yes, you're feeling pain, but if you don't have something to even take care of yourself. When you read the tweet about the person who got her first period wearing a white dress in a public place, I cannot imagine the trauma that that young girl will have. But it's very interesting that she had lots of support from her mom and all the other women there. So you can't compare, the stigma and the trauma of having a soiled dress in a public place, soiled with period, because you cannot afford period products versus the pain. You will not remember the pain then because of the embarrassment, and everything, which is really sad. So I think typically we have lots of conversations majorly going, around being able to access period products, you know, the actual thing that, yeah, we have a large number of people who do.
Thank you so much, Mr. Apuamah. Sincerely, that's why we have. I agree with you. I largely agree with you. That's why we have many non-governmental organizations working to provide period products for Nigerian women. There is significant period poverty. That's why also some organizations which I've also worked for are teaching women how to make reusable pads, how to sew reusable pads. And I also kudos to your foundation, even though you don't want to blow your trumpet. There was a time you talked about menstrual cups. Actually, the first time I
Yeah.
knew about menstrual cups that exists from your foundation.
Oh,
So
wow.
yeah. Thank you for the work you do in helping Nigerian women solve period poverty. Period poverty is a big issue in Nigeria, and now with even the worsening socioeconomic status of the country, like many people result into reusable pads, the sewable ones, and I want to use this as a platform to all relevant stakeholders. Something that happened when I was in secondary school was government. I don't know that it's Ministry of Health, but I just know it's the government. And they didn't do it for only my school in Abuja. They went around secondary schools in Abuja to the best of my knowledge. And they were given sanitary pads to women. Many people took like 6, some people 5, you understand.
Mm.
One thing is you can say sanitary pads are very safe, but when you say you are using reusable pads, how safe is it? Are you drying it under the sunlight? Are you washing it well? Which chemicals are you using to wash the sanitary pad? even though it's reusable. So in the long run, as a medic and personally, we are still talking about proper washing of underwears for women. Now we are moving it to sanitary pads. We are still managing underwears for women. So if that is not solved, actually, as a medical advice, if you have the money, just buy the sanitary pads, because if you are not doing what you are supposed to do perfectly with regards to the reusable towel, reusable sanitary pad, you might get an infection or whatsoever. So this is a platform to all relevant stakeholders. Please invest. I don't know what happened, who was empowered. I can't remember who was empowered during that period or who was in charge to do that across schools in FCT. Please, commissioners for health, minister for health, relevant NGOs that can do that. I'm not mentioning international NGOs because these are basics. It's not what are they calling it? It's not big projects for the country. Relevant stakeholders, commissioners for health, please come up with ways you can provide monthly sanitary pads for the country, for Nigerian women. I don't know why we have situations where you have free condoms. I feel free sanitary pads are priority, because you can say you don't want to have sex, you can abstain from sex, but you can't abstain from menstrual flow. So instead of providing free condoms across the country, please provide free sanitary pads. They are priority. They are priority. And I feel why we have free condoms, because we have lesser women in power. If more women are in power, I feel we'll have more voices talking for women and knowing that this is what should be done. But because men are the ones in power, they are solving their problems. I'm not trying to insult women, but they're solving their problems. Sanitary pads are priority compared to condoms. So please, I'm optimistic that with platforms like this, whoever is in charge at national, state, and local level, we can have even though it's reduced price or free sanitary pads, Nigerian government has the money, free sanitary pads for Nigerian women, especially those going to school. Pharmacist Apuamah discussed earlier that she would mix schools on some day because of pain. If a lady knows that at school she's going to get free sanitary pads with the cost of sanitary pads now, she'll be moved to go to school. So, and it will also reduce on some psychological effects she might face. So please, relevant stakeholders, please do the needful with regards to that.
Know of I read about a northern state in Nigeria. I don't remember which, where the governor has approved. I don't know if they've done it, but they've approved that the all secondary schools in the states should have access to period, products.
Wow.
And so I'm currently in the process of proposing also to another state government to say, look, someone has done it. You can also do the same and even better. Because if it means going, should I say, going political, the most important thing is ensuring that women have access to these things. So beyond just advocating, serving as a pointer, a reminder, accountability partners to our governments to say, oh, please, could you do this? Just point them in the right direction of how to design their policies, of the projects to take on. And I slightly disagree with you on the topic of it's important actually that women have this period product, and then that they also have something sustainable, because and that's where topics of conversations around reusable pads come in, and menstrual cups, and even period panties. Funny that despite being an advocate, it was my very first time trying period panties just a couple of weeks ago. Trying the period, and just super comfortable. But then, like any other, and I understand where your concerns are with washing with actual soap and water and ensuring that it dries. But that is why when we're having conversations around period products or menstruation, it goes with this topic wash, water, sanitation, and hygiene.
Mhm.
They need clean toilets. So beyond having access to period products, do they have toilets where they can change in the schools? Are the toilets clean? Do they have water to wash their hands there, or to wash their period panties or whatever they are using? Do they have access to soap? And as for whether it's sunrise or not, because of the work that we do with the NGO and how we're hoping to scale it to the next level, I don't want to share too much yet, but we're trying to scale it up to the next level to ensure that it's more sustainable, that beyond donations, that we can actually, help women and young girls to have um, sustainable access, to this product. So it's not just, oh, our funding can support you for 1 or 2 months. So what happens for the rest of the year, or the rest of before you become financially independent? So we're working on that, and I've been having conversations with lots of companies internationally, locally, around this topic. And I recently learned, excuse me, that there's some innovations now in reusable pads, where a person can wash, with not so much water, and not require too much sun to dry it. You can wash it, and in a couple of hours, just having exposure to air, even though there is no sun, and it dries. And yet the materials are antimicrobial. They cannot
That's
come
good.
down. I was shocked myself. And despite all my years of advocacy, I only learned about this barely 3 weeks, 4 weeks ago, when I had a conversation with this company. So there are so many things that are going on. But another thing is, despite the information we have, having and this also an avenue to also seek support. With little or no resources, we've been able to do so much. We are the kind of people you should give your money to. Look at our track record, what we've been able to do without any proper grant. We've been able to, speak to individuals, companies, have partnerships to do things with little on just mere donations, and from personal savings, family and friends support. So please, we're the kind of people you should give your money to help more people. Thank you.
Thank you so much. Thank you so much, Master Apuamah, for elaborating on that. Actually, I'll get the link to your foundation and add it to the YouTube channel in case anyone wants to
Okay,
contact you. Any link they can contact you through
I'll
to
be happy to.
donate to the foundation, because she's doing a good job, and this is what we want for Nigerian women. Um, Another aspect, I feel Nigerian states are not. One thing is they don't copy each other. Nigerians, they don't copy each other in good. That's why you find some states like Kano State giving scholarships, Northern State, Jigawa, Sokoto giving scholarships, and you find states like, let me not talk about that, because Ondo, Ekiti, Ogun State, they are not giving. Like, when I feel when a state is doing something good, other states should not turn a blind eye and be like, oh, they are not saying what they are doing. When you say a state is doing something, like, bring it into your state for your people. Like you just said, the northern states is planning on giving period products, put period products in public places to be accessible for women
Mm,
regularly. This is something
yeah,
that
in
other states should
schools.
copy. This is a good initiative
Yeah,
other states should copy and do for their citizens. I feel every woman in today's age deserves soft life. As we usually say, every woman deserves soft life. Um, what we are one thing is, when you leave Nigeria and see and pay tax and see what is how the government of a specific country is using your tax, you are not really annoyed at how they are using, because you are enjoying the services they are providing from your tax deduction. But in Nigeria, we are not really seeing the services we are getting. You are even paying more on top of out of pocket for the services you're getting. So please, this is the continuous call to relevant stakeholders to do better. We can do better. I'm sure we have the capacity to do better. So, Pharmacist Apuamah, to another question. Um, Having done projects on period poverty, menstrual hygiene, which includes the use of menstrual cup, Do you feel the psychological impact increases dysmenorrhea? The psychological impact of period poverty. Do you feel it increases dysmenorrhea?
Yes, I believe it does. I mean, um, research has shown that young women who struggle to have or to access period products report more pain because you're worried about, oh, my next period, or my period is starting in 2 days or in 3 days. I don't have what to use. Even as adults who are financially stable and can access period products and pay for them, if you notice that the months you stress the most, you have more pains on those months. How much more a young person who's trying to access, who doesn't have period products and probably in school and is concerned about getting her school uniform soiled in the presence of her male classmates. So yeah, it does affect and and it impacts on these women.
Thank you so much for that. It is reported that adolescent girls tended to have prevalence of primary dysmenorrhea than older women from the paper. Indeed, age less than 30 years was found to correlate with increased risk of dysmenorrhea. Should we advocate, we as you as a pharmacist, me as a doctor, we are advocates, should we advocate to girls to be optimistic of mild or no dysmenorrhea as they approach menopause?
It's could be. I mean, as positive as we should be, we should also pay attention to the medical and the scientific part of it. Like I mentioned during my research and also from personal experience, that childbirth actually has been shown to reduce period pain, or should I say, women who have gone through childbirth report lesser period pains than women who haven't. But then that also becomes arguable in this age and time that we are, where some women are not interested in having children. So what conversation, what hope do we offer to such people who already have severe menstrual pain? I would just say get help, get as much help as possible. Yes, there's a chance that if you have children, you could have less pain because maybe your pain threshold increases from the everything that has to do with pregnancy and delivery and postpartum. Yeah, that's all I can say for now.
Okay. Actually, I'll use as what are they calling it? I'll use it as an experience I've seen with some people close to me. I used to have some people close to me who had dysmenorrhea, and you would see that their complaints reduced as they got older. I know someone who said her menstruation and manic around 14, 15 years, and she's close to 40 years now, and she doesn't have those issues with dysmenorrhea. So she has children, of course. We know part of the things that is said to reduce dysmenorrhea as a woman grows up is parturition and also sexual activity. And this is not a platform to advocate for sex before marriage. So please don't say you edit from this platform. So please don't say you edit from this platform that sex reduces dysmenorrhea and you go and start sleeping about because you want to reduce dysmenorrhea. Please, this is a disclaimer. Please don't take this from this platform. We're just trying to say, as a woman grows older, as she said, if you say you are not going to have children, like add and other activities, other activities around getting pregnant. So I find it as if I have a younger generation who have dysmenorrhea and they are close to me, that's what I'll basically tell them about dysmenorrhea. Like, these things get better. Even though you are getting close to menopause, menopause is another drama on its own. Women were in between drama of menarche and menopause. Menarche, the drama of menarche, the drama of menstruation, then drama of menopause. So if any woman around, you don't be giving her money. Don't be spending for any woman around you, because women are going through a lot. Because menopause, when you're also discussing with women who are going through menopause or premenopausal, it's a lot. It's a lot. Different things are happening to the body. So back to menstruation. It gets better as you grow older, and yes, this is a disclaimer for you not to have sex before marriage. Pharmacist Apuamah, the last question, I feel, if it's not the last. Oh, parturition reduce dysmenorrhea, but not in women with abortion or miscarriage. What month does this relate to? Cause pregnancy, whether live on or unalive, whether you have a live fetus or an unalive fetus, pregnancy is pregnancy. So when do you associate it? Dysmenorrhea and parturition affecting dysmenorrhea.
So I honestly don't know how like those who reported abortion came in. It was just based on the data that was collected, and then we began to associate. Oh, this person said this, and said that even though they were having period pains before and they got pregnant, maybe they had an abortion, whether medical abortion or not, but afterwards it continued. So I think it might be an area, to research further to know what is really, the cause of it, whether it's therapeutic abortion or not. Why does why do women who have had abortions still have period pains relative to other women who have had live pregnancies? So I feel like it's an area we need to look into more, because for me it was just about, oh, this is what the data said, but I couldn't explain really what was the reason behind it.
Because I find it as an interesting part of the research when I was reading it, that women, in as much as parturition reduces menstrual pain after a woman gives birth to live fetus, but those who have abortion, like there is no significant difference in dysmenorrhea pre-pregnancy and post-abortion. So I feel, like you said, there will be more research if there is no research done on it already.
Could be. I think we need to check that. Could be.
I would need to check that and know the fact. How many months? 5 months, 6 months, 7 months? Does the woman need to be 7 months long, 7 months gone to be able to reduce our menstrual pain? Just give us a closing statement.
Okay. Thank you so much for having me, Dr. Fajembola'S. I really appreciate it. And I appreciate your platform and what you do. Although I didn't follow closely or in details the previous interviews you have, but I think it's important, that we have platforms that give, medical information, opportunity for people to share what they're doing, not just for themselves, but for the audience and the people who will really benefit from the information. Thank you so much for having me.
Okay, thank you so much, Dr. Thank you so much, my sister.
I will be.
Let me advocate on behalf of your dad. Thank you so much, Professor Apuamah. Yes, thanks so much for the discussion. It looks simple because we are in the field of health, and it's what we usually do.
Yeah.
And also because we are women, it's what we face. I wanted the discussion to be like a breath of fresh air for women to learn about dysmenorrhea, because some women, when they get tested many times, when they go check themselves at the hospital, maybe it's endometriosis, they find out that it's not endometriosis, it's dysmenorrhea. And whether primary dysmenorrhea or secondary dysmenorrhea, people have different aspects of them that makes them unique in terms of dysmenorrhea. What are the factors contributing or relieving one of dysmenorrhea? Is it your blood group? Is it your lifestyle? Is it your BMI? Different factors. So I'm optimistic with this platform. Anyone listening to this, whether you're a man or a woman, in fact, I encourage more men to be in such discussions so they can help the women around them better. You know that dysmenorrhea gets better as you grow older. and also with situations like parturition, you are relieved of your pain. So thank you so much, Dr. Apuamah. Thank you so much, Sister Apuamah. Thank you so much for Apuamah for gracing us as a first woman and also sharing your expertise with us. Global citizens, if you've not read this paper, it's on dysmenorrhea among women in Delta states. Please, I posted it on my weekly reads, so please go read it and discuss it with colleagues, and also use the needed knowledge for yourselves. My mantra is each one help one. I want everyone to be better people with better knowledge and to be able to help those around them effectively. Have a blessed week.